Hello and welcome to Pace Hospital's podcast. Today, we are shining the light quite literally on one of the most essential yet often overlooked nutrients for your health, that is vitamin D. Commonly known as the sunshine vitamin D plays a crucial role in bone strength, immunity, mood regulation, and even the prevention of certain diseases. Joining us today, Dr. Mounika Jetti, Consultant General Physician and Diabetologist at Pace Hospitals, Hyderabad, with extensive experience in preventive medicine and nutritional health. In this episode, Dr. Mounika takes us to an in-depth conversation on vitamin D, what it is, why it is essential, how it affects our overall health, and the signs of deficiency. She also sheds light on daily requirements, dietary sources, the role of sunlight, supplementation, and the practical ways to maintain optimal vitamin D levels. Dr. Mounika Jetti, thank you for joining us today at Pace Hospitals, Hitech City.
Hi, I'm Dr. Mounika Jetti, Consultant Physician, Pace Hospitals, Hitech City. Today, we are here to discuss about vitamin D and its importance in health.
Let's start by understanding what is vitamin D and why is it important.
Vitamin D is an essential nutrient which helps in the absorption of calcium and phosphorus, which is essential for the maintenance of bones, muscles, and also teeth. Vitamin D also plays an important role in immunity and also cardiovascular health.
So, doctor, how does the body produce vitamin D?
So, vitamin D is mainly produced in the body by sunlight, which gets absorbed into the skin. The ultraviolet B rays in the sunlight gets absorbed into the skin and converts 7-dehydrocholesterol into pre-vitamin D3. This pre-vitamin D3 undergoes a temperature transformation into vitamin D3. This vitamin D3 or cholecalciferol enters into the bloodstream, goes into the liver, gets hydroxylated and forms 25-hydroxy vitamin D3. This 25-hydroxy vitamin D3 is the circulating form of vitamin D3, which then goes into the kidney and collects oxygen and hydrogen and forms 125 vitamin D3. This 125 vitamin D3 is also called calcitriol.
Dr. Mounika Jetti, what are the different types of vitamin D?
So there are two types of vitamin D, which is vitamin D2, which is ergocalciferol, which comes mainly from plants and yeast. And the other form of vitamin D is cholecalciferol, which is vitamin D3, which comes from sunlight exposure and other dietary sources like fatty fish, omega-3 fatty acids and egg yolks, etc. Vitamin D3 or cholecalciferol is easier for absorption than when compared to vitamin D2.
Doctor, what is the recommended daily requirement of vitamin D for different age groups?
The recommended daily requirement of vitamin D depends on the age of the individual. For example, if the individual is a baby whose age is less than 12 months, the daily requirement is 400 international units. For ages between 1 to 70, the requirement is 600 international units. And for ages above 70 years, the requirement is 800 international units.
So, doctor, can a person really get enough vitamin D from sunlight alone?
It is one of the most common questions everybody asks. If we stand up in the sunlight for a longer time, is it enough for the production of vitamin D? Yes, it is enough, but there are other factors which will also influence the production of vitamin D, such as age. Older individuals have lesser capacity to develop vitamin D, even though exposure is the same, but the younger individuals might produce more vitamin D when exposed to the same amount of sunlight as old people. Second thing, skin color of the skin. Darker people will have melanin, which will reduce the absorption of UVB rays, so thus by reducing the production of vitamin D. The other most important factor is time of the day. Everybody thinks that if we stand in the sunlight during early hours of the sun, vitamin D production is more. But that is actually wrong. The midday sun is most important and effective time where we can produce more vitamin D. Midday sun is from 11 o'clock in the morning till 3 o'clock in the afternoon, where the sunlight is higher and the UVB rays are also in the higher concentration. So a daily common exposure of 10 to 30 minutes without any sunscreen for a limited time of 2 to 3 episodes per week is essential for the production of vitamin D if only sunlight is the source.
Could you explain what are the dietary sources of vitamin D?
Vitamin D is found in both animal and fortified plant products. The animal products contain more amount of vitamin D3. The examples are fatty fishes like salmon, tuna, etc. Omega-3 fatty acid, egg yolks, etc. have higher concentrations of vitamin D. Where it comes to fortified plant products, the fortified foods like cheese, butter, and also almond milk, soy milk, etc. will have higher concentrations of vitamin D. When talking about fortified plant products, fortified dairy products like milk, butter and cheese have higher concentrations of vitamin D, and other kinds of milks like almond and soy milk will also have higher concentrations of vitamin D. But the source of vitamin D, animal source of vitamin D is comparatively superior to the plant-based products.
Dr. Mounika Jetti, what are the symptoms of vitamin D deficiency?
Vitamin D deficiency symptoms vary depending on the level of deficiency. The most common symptoms of vitamin D deficiency are easy fatigability, multiple infections like reduced in immunity, bone pains, muscle pains, etc. If the person is severely deficient, there are conditions like osteomalacia or osteoporosis where the bones become severely weak and are easily fractured. And in cases of kids, we observe a condition called rickets where the vitamin D is very low, so that there are deformities in the formation of the bone itself, and also they result in developmental anomalies.
Can you explain how is vitamin D deficiency diagnosed?
Many people with vitamin D deficiency will not have symptoms as early as, like, if the deficiency immediately starts, they don't develop symptoms immediately. But to check about the vitamin D deficiency, we have to take a proper history about sun exposure, kind of sunscreens they use, and also other outdoor and indoor activities. How much time do they spend outdoors? How much time do they spend indoors? So if we want to know the exact level of vitamin D, we have to do a blood test which will measure the accurate levels of vitamin D, and then we can diagnose the deficiency of the disease.
So, doctor, can vitamin D deficiency cause fatigue or depression?
Vitamin D deficiency causes muscle fatigue because the vitamin D helps in the absorption of calcium and phosphorus. So, the deficiency of vitamin D will cause reduced absorption of calcium and phosphorus, leading to muscle fatigability, easy fatigability and tiredness. And also, vitamin D plays one of the important role in brain regular function. So, there are studies which prove that vitamin D deficiency might cause depression in some people.
Is vitamin D good for the immune system?
Vitamin D plays a major role in modulating both innate and adaptive immunities. Innate immunity is the first line of defense, and adaptive immunity is a long-term defense. In case of innate immunity, vitamin D helps in the production of antimicrobial cytokines which will kill the microbes, thus by reducing the incidence of infections. Whereas in case of adaptive immunity, it helps in the modulation of T cells, thus by reducing the infection incidences.
Dr. Mounika Jetti, do pregnant and breastfeeding women need extra vitamin D?
Vitamin D is required in higher amounts in gestational and lactating women, as it helps in the improvement of bone health, immunity, and also the muscle development of the baby and also the mother. So the daily requirement of the gestational and lactating women should be somewhere around 600 international units.
Can vitamin D improve skin health or conditions like psoriasis?
Vitamin D plays a major role in skin health, as it promotes or strengthens the skin barrier, thus by reducing the dryness of the skin. It increases the collagen production, and it also has anti-inflammatory effect which will help in maintenance of skin health.
So, doctor, what is the connection between vitamin D and psoriasis?
Psoriasis is an autoimmune condition which is characterized by rapid keratinocyte production and chronic inflammation. Vitamin D has an anti-inflammatory effect, and it also regulates the keratinocyte production, thus by reducing the dryness and also scaling of the body.
Doctor, what is the ideal time of day for sun exposure to ensure our body produces enough vitamin D naturally?
Production of vitamin D through sunlight depends on multiple factors, as we already discussed. For individuals who are lighter skin, a daily exposure or weekly 2 or 3 times exposure of 10 to 30 minute intervals without any sunscreen is recommended. But in cases of darker individuals where the melanin is high, this melanin will block the UVB rays. So the exposure of 30 to 60 minutes in 2 to 3 intervals in a week is recommended for the sufficient production of vitamin D.
Dr. Mounika Jetti, can we take vitamin D supplements without consulting a doctor?
Supplementation of vitamin D without doctor recommendation can sometimes be hazardous. As vitamin D is a fat soluble vitamin, it is not like vitamin B12 where it gets excreted if the levels are extra. So vitamin D when taken in excess amounts may become toxic, where we consider toxicity more than the levels of 100 nanogram per milliliter.
What are the signs and symptoms of vitamin D toxicity?
What are the signs and symptoms of vitamin D toxicity are? People may come with vomitings, nausea, excessive sweating, and also kidney damages. Sometimes we see liver damage also in patients who consume more vitamin D than recommended. So if you want to start a vitamin D supplementation, please do check the levels of vitamin D and then take appropriate supplementation for the required amount of time.
So doctor, one final question. Is vitamin D safe for people with kidney disease or liver disease?
In case of kidney and liver diseases, it is safe to give vitamin D, but the dosage and form of vitamin D should be different. In case of kidney disease, active form like calcitriol is recommended with daily or intervals of measuring of serum calcium and phosphorus levels are required. Where in case of liver disease, active vitamin D or D3 or D2 can be given, but the dosage is more when compared to the normal population. These are the most common doubts which we have in mind when it comes to vitamin D. If you have any further queries, please contact Pace Hospitals, Hitech City.
We hope this episode has provided valuable insights for our listeners. Vitamin D might be a small nutrient, but it plays a big role in maintaining our overall health, from bone strength to immunity and beyond. If you have any further questions about vitamin D, please don't hesitate to consult with a general physician. Prioritize regular checkups, balanced nutrition, and safe sun exposure as part of your wellness routine. Thank you for tuning into the Pace Hospitals podcast. We will be back soon with another informative episode. Until then, take care, stay healthy, and keep soaking in the sunshine wisely. Thank you.